Hey, my name's Adam. I'm going to be your nurse for today. Can you tell me your name and birthday, please?
Caroline Hawkins, and March 27, 2001.
All right, thank you very much. And do you know where you are today?
The hospital.
And do you know what today's date is?
September 24th.
And do you know what you're here for?
Just a checkup.
All right, so before I begin, are you in any pain at all?
No.
All right, so good. So to begin the head-to-toe assessment, the first thing I'm going to judge is how you carry yourself, how you walk. So first, can you stand up for me? Can you walk over there real quick? And then come back. And then you can take a seat. All right, so first off, the patient is alert and oriented to person, place, time, and situation. The patient's gait is steady with no slouching in her posture. It's erect. She's very controlled, no issues with balance. The patient appears to be calm and cooperative, and she speaks clearly and concisely when answering questions. All right, so again, to begin the head to toe, can I first get you to take your glasses off? Thank you very much. Are you okay if I touch you?
Yes.
All right, so the first thing I'm going to do is just take a little feel around your ears. Is that okay?
Mm-hmm.
All right, does this hurt at all?
No.
All right, so I don't see any redness or drainage. And there's no pain at all involved. There are piercings, but there's no signs of infection. And generally, just looking at the skin appears to be clear, smooth, and dry. No discoloration noted. No signs of edema, bruising, scarring, any lesions. The face seems to be normocephalic, and the facial symmetry is noted bilaterally. So the first thing I'm going to do outside of that is I'm going to do a quick little eye exam. So I'm just going to take a look real quick and note that your pupils aren't equally rounded. Now I'm going to see how they react to light. So the first thing I'm going to do is take this pin light and shine it in your left eye, and then in your right. All right, both pupils react equally to light. Next thing I'm going to do is check for accommodation. So if you follow this pin light all the way to your nose. All right, good. Now I'm just going to take an actual look at your eyes. I'm going to pull this down real quick. All right, the conjunctiva are pink, the sclera is white, and the corneas are clear. Now what I'm going to do is do a quick little nose exam. If you can tilt your head back for me. All right, I see no deviated septum. The airways look clear. I'm going to check for patency now. So can you go like this and blow? And go like this and blow. All right, the nares are patent. Next thing we'll do is take a quick little look in your ear as well. All right. Very good. Next thing, can you open your mouth for me? All right, say ah.
Ah.
All right, the uvula appears to be midline. The mucosa is pink and moist, and the teeth are intact. So now what I'm going to do is I'm going to check for your carotid pulse. So if you can face like this way for me, with your head. So the first thing I'm going to do is palpate just the right side carotid, and then the left. And this is to prevent cutting off blood flow to the brain. But both pulses are a +2, they are strong, and they are equal. Now I'm just looking at respiratory effect. The patient appears to breathe independently with no use of accessory muscles. The patient does not appear to be laboring with the breathing. All right, so the next thing I'm going to do is just take a quick little look at the skin itself. Usually I would have the patient take off as much clothes as they could, but for modesty's sakes, I'm gonna let them keep their shirt on. But from what I can see, the skin appears to have no discoloration. There's no signs of edema, lesions, scarring, or bruising. There's some freckles, but again, the color is respected to age and race, so no signs to worry. Next thing I'm going to do is listen for heart sounds. There are 5 points to listen for on the heart sounds. The first one being the aortic. That is found with in the second intercostal space, along the right side sternal wall, the right of the patient. The next sound is the pulmonary auscultation point. That is also in the second intercostal space, but along the left sternal wall. The next point is Erb's point, which is in the third intercostal space, along the left sternal wall. The next point is the tricuspid point, which is in the fourth intercostal space and along the sternal wall. And then can you lift your, all right, thank you. And the last point is the mitral point in the fifth intercostal space. All right, good. Now what I'm going to do is flip my stethoscope over so I can use the bell, and I'm going to listen to the vascular sounds again, but with the bell. Alright, so upon auscultation, I have noted the normal S1 and S2 sounds in all 5 auscultation points. I heard no murmurs or clicks, which is good. I don't want to hear any of those, so everything is normal. Next thing I'm going to do is auscultate for lung sounds, and so I'm going to listen to 6 points on your chest, your anterior side, and 8 points on your posterior side. Again, I will be using the diaphragm to listen for the lung sounds. And again, for modesty's sakes, I'm not going to have my patient remove their full shirt. Usually you would listen completely on the skin. Just breathe normally for me. Can you move for me?
Mm-hmm.
Thank you. Alright, and can I get you to face this way for me, please? Now I'm going to do the posterior lung sounds. Alright, so upon auscultation of the lungs, all of the both posterior and anterior lobes appear to have equal sounds bilaterally. There were no adventitious sounds noted, which include things like cracks and wheezes, which is good. We won't hear any of those. The next thing I'm going to do is have you lie supine for me. So in the supine position, to make it a little easier to see, I'm going to move the camera. Alright, so the first thing I would check for is JVD, jugular vein distension. There is no JVD noted in my patient. Next I'm going to listen for the abdominal bruit. So I'm going to roll my patient's shirt up. And go to the bell. Alright, no abdominal bruit noted. The next thing I'm going to do is just take a quick look at the abdomen. The skin color appears to be consistent with the body. No discoloration noted. No edema, any wounds, no bruising, scarring. Everything appears to be regular. Also, no distension is noted. Next, I'm going to take the apical pulse. And in most cases, I would do a full vital range or vital signs check, but because this patient has already had their vitals done and it has been charted, I will not be doing that. I will just be checking apical pulse just to get a sense. And I will be checking it for a full minute. So just try not to run away from me. Alright, my patient's apical pulse was 68 beats per minute, which falls within the healthy range. The next thing I'm going to do is listen for active bowel sounds. Alright, and the bowel sounds are active equally in all four quadrants. The next thing I'm going to listen for is your abdominal bruit. Just real quick. Which the abdominal bruit is found just under the xiphoid process and between the xiphoid process and the umbilicus. No bruit noted. The next thing I will do is lightly palpate the stomach. Does this hurt at all?
No.
Any tenderness or
No.
sore at all? And once again, there's no distension noted. And then at this point, I would usually get a femoral pulse from my patient, but for modesty reasons, I won't be doing that. But the femoral pulse is found right along the groin here. And I would also palpate that bilaterally and get a pulse bilaterally from that. Now that I've done all that, you can sit back up for me. And I will once again move the camera. Alright, so now I'm going to do a quick assessment of your extremities. So can you stick your arms out like this for me? Just briefly going over, I can see that the color is again consistent throughout the body and with age and ethnicity. no discoloration noted. There are some freckles, but there's no edema, bruising, scarring, or lesions. The arms appear to be slightly warm. All right, next thing I'm gonna do is check you for capillary refill. So I'm just gonna push in the nail bed like that. Refill is less than 3 seconds on the right arm and on the left arm. All right, the next thing I'm gonna do is have you stick your arms out like this. I'm going to feel your radial pulse. The radial pulses are bilateral at a +2. Now I'm going to feel your brachial. You can just stick your arms out like this. And the brachial pulses are also at +2 bilaterally. The next thing I'm going to check you for is I'm going to do some range of motion. So can you stick your arms up like this? This will be some strength testing. So just push against me. All right, push against me. Push against me. Push against me. All right, now I'm gonna do your shoulders. Push up. All right, good. And now your head and neck. So go up, down, left, right. All right, good. Now I'm gonna move on to your lower extremities. If you can, stick your right leg out for me. All right, so there's no discoloration. Once again, it is consistent with the rest of the patient's body and also for her age and ethnicity. There is some bruising noted. And once again, like the arms, the legs are slightly warm to the touch. Now I'm gonna check the left leg. Once again, the color is consistent with the rest of the body, also consistent with age and ethnicity. There is some bruising noted, but no scarring, lesions, edema. And once again, the left leg is also slightly warm to the touch. Now, I'm going to check for the patellar reflex. If you can scoot back for me, yeah. You have your patient dangle their feet a little bit. All right. And there is the patellar reflex noted in the left leg. All right, and the patellar reflex is noted in the right leg as well. Yeah. All right, so the next reflex I'm going to test is the clonus reflex. You want the clonus reflex to be negative, so I don't expect to see it in my patient, but what you would do is you would take the foot, hold it in this hand, and dorsal flex. And then as you see, there is no reaction, which means they are negative for the clonus reflex. But any patient that does have it, when you would dorsal flex like that, the foot would start jerking like that. So no clonus in the left foot, and no clonus in the right foot. Next thing I will do is go over some more pulses, and the post-tibial pulse would be here. And I'm just showing this right now for educational reasons, and then I will palpate both bilaterally. All right, and both post-tibial pulses are a +2 bilaterally. Once again, I will be showing you the dorsalis pedis pulse, which is along here. And I would be palpating both of these bilaterally as well, but just showing off for educational reasons. And once again, both pulses are at a +2 bilaterally. Now I'm going to do again some more strength testing exercises. So if you will, push against me. All right, good. Now push against me. All right, now right foot up. Push down like you're pushing a gas pedal. And then dorsal flex up towards me. There you go. Now left foot. Gas pedal. Good. And up. Good. All right. I think that about sums us up. You can lay back down in bed. Gonna go ahead and lower your bed and lock it in place. I'm gonna put both side rails up, only ×2. I'm gonna put a call light right next to you. In case you have any questions, we'll come in here. Before I leave, do you have any questions at all?
No.
Any concerns? Do you need anything?
No.
All right, well, I'll be back in to check on you in a little bit. I'm gonna take your chart with me here so no one can see it. so we can maintain HIPAA. And again, if you have any questions, just feel free to call me, okay?
Good night.